Namaste, Jai Hind, and Namo Buddhaya. I am myself Sumati from Mahaprajapati Gautami Subharti School of Buddhist Studies, Ras Bihari Bose Subharti University, Dehradun. Today, I am glad to say that I have one special guest with us to talk about her experience in the nursing field and her thoughts about Buddhism. You're most welcome, ma'am.
Thank you so much.
Would you like to introduce yourself
Sure.
first?
My name is Saroshni. I am from Dehradun and I have done my GNM, post basic and masters from Jobbigram, and currently working this college as a nursing tutor.
So, how had been your journey in nursing field? Why did you join this field?
It has been now 10 years, more than 10 years I am working in nursing field now. I have joined GNM in 2010. I am currently student to do, so it has been like 11 years of journey now. It has been so tough, rough and tough journey I have faced. I have seen so many problems in GNM also, in both basic also, in masters also. But currently I am working as a nursing faculty in this. So it has been very tough journey.
Why you chose to be a nurse? Was it a childhood dream or someone inspired you?
No, actually my grandma inspired me by choosing this profession. In my home, all are bankers. My mother is banker, my father is a banker. My both brothers are the doctors in English hospital. But I was the only one for the first was from my village, from my own house plan, because I've seen my grandma. When she was paralyzed when I was in class 12, and we have admitted her in the English hospital now. But their nurse was so rude to her. They used to beat her. They used to pull her leg. They used to beat her mom very badly. So this encourages me to do nursing. I thought, why should my grandma and other grandmas and other patients face such kind of problems which I'm facing today? I'm very close. I was very close to my grandmother. So she was like next mother to me. So when I've seen so many suffering, she is suffering, and the nurses are not treating her properly. She used to beat her. She used to, they used to push her hair also, in front of me. So when this inspired me to being a part of this profession, and trust me, ma'am, this is the best profession I've ever met and I've ever known about this profession.
Wonderful. You are inspiring me as well. Okay. So, as we had talked before, and you were telling that there was someone in your family who inspired you about Buddhism. So, would you tell us
Sure,
some
ma'am.
more about
I would love to share this story, ma'am. Ma'am, in summer vacation, we used to go to my Boaji and my Fufaji house. So they are basically from Srinagar, and ma'am, my Fufaji used to tell us the story of Lord Buddhism. He was born. He lived a very lavish life, but only for the moving of this pain and searching. He went, and he done so much for this nation. And we used to say, why are you telling me the stories again? But after 1 year, every year he used to tell us the stories. It was so beautifully he used to tell us, ma'am. Then this inspired me a lot. Why should I try this? Or why should there's some spark in his story, ma'am, which just alerted my brain. Let's do something for this. So from there I got this stone.
So you still have those childhood memories
Yes,
of the stories of Buddha,
yes,
which inspired you?
I still have, ma'am. I thought, ma'am, if I were at that time, I used to live that lavish life. Why should I go and search for the people who are suffering from pain, from cuts and from disease? So if I would be there, I used to live that life, ma'am. But Lord Buddha, he himself moved away from that lavish life, and he go for the for doing something for the people out there, ma'am. He thought, why I am the who's living the lavish life, why other people are getting this chance. So this inspired me a lot, ma'am. When a single person can move out of their house just for the removing of the pain of others people, why can't we people? And this also inspired me to work as a medical field, so that I can contribute a small amount. I can contribute in order to get my patient to get relief from all this suffering.
So inspiring. Yeah, and as you said that you had been working with patients, so did you have any kind of strong experience with dealing with patients, and where you felt that it's really challenging, and then how did you deal with that?
And nursing is the only one field which is very challenging. If I say in a very simple word, ma'am. When I was doing GNM, I have seen so many cases in 10 to 13 years, in 10 to 13 years now. I've seen so many patients, and they were dying, they were pain. I still remember one case now. There was one woman, she was having breast cancer, and although she was having uterus cancer also now. And as you know that CS service is the leading cause of death in women in current scenario now. And she was saying, please मुझे मौत दे दो, please मुझे मौत दे दो, I want to die, I want to die. She was saying like this time. And we were hopeless कि यार we can't do anything for this kind of people now. And as you know that mercy killing भी Indian में लागू नहीं हुआ. But ma'am, this I've seen so many cases. When I've seen that one, the grandfather was there now, and he was also dying. You know, he was saying कि मेरे आसपास कोई भी नहीं है मेरा अपना. Where is my bahu? Where is my son? Where is my child? I have four sons. I have four bahu. I have so many children, but currently no one was present over there. So ma'am, these things inspire me a lot, and I can say that nursing is the only one profession through which we can serve the people in one way or another.
And so, do you find, I think you are very much convinced with the teachings of Buddha, but still, do you think that the teachings of Buddha is still relevant in your field?
Yes, ma'am.
And there is very much a relationship between the teachings.
Yes, ma'am. Yes, ma'am. Yes, ma'am. Definitely. Like first one was non-violence. Because ma'am, as a nurse, I have to deal with the psychiatric patient. And ma'am, if you see a psychiatric patient, they are very aggressive in nature. They are very mania. They have hypermania, mania, schizophrenia. And sometimes they come and beat us also. And for that only we have to maintain the silence. We have to be in a peace state, and we cannot treat them like animals, ma'am. We have to be very patient, ma'am. And this one teaching from non-violence, like be very transparent with the patient. And the first one was like truth. And we deal patient with very truthfulness, man. We never lie to them, their family. Ki nahi, your patient is going to lie, don't do that, don't do this. We only make it very clear to them, man, ki your patient have only this much of time, and you can serve them at your best. So, ma'am, unlike this, there are so many things, ma'am, which makes you believe that Buddhism and nursing are very friendly. I can say that they are twins, ma'am. They can go in parallel to each other. Yes.
Wonderful. Thank you very much for talking with us and sharing your experiences.
It was an honor. It was an honor.
All the very best.
Thank you so much. Thank you.
Thank you very much.
Thank you.
Namo Buddhaya.